Welcome to the Psychosocial and Spiritual Needs of Older Adults presentation. This presentation will focus on identifying the psychosocial and spiritual needs of older adults. It also highlights the importance of collaboration between healthcare professionals to address these needs and connect patients or caregivers with appropriate resources. Spirituality goes beyond religious beliefs. It encompasses the ways individuals seek and express meaning in life and experience their connectedness to themselves, others, nature, or a higher power. It is an inner force that guides personal uniqueness and gives strength. Research shows that addressing the spiritual needs of elderly individuals, especially in care homes, can improve life satisfaction and emotional well-being. The context. Many people have a belief system, while others do not. As we age and our bodies slow down, spirituality often takes on greater significance as life's big questions come to the forefront. We begin to reflect on who we have been, what has happened in our lives, and what it all means. Spirituality frequently involves a search for meaning and answering questions such as, who am I? What has my life been about? What truly matters? What can I do now? Spiritual care responds to the needs of the human spirit during trauma, illness, or grief. It can involve offering meaning, supporting self-worth, facilitating faith practices, or simply providing a sensitive listener. The essence of spiritual care is in forming compassionate human connections that address an individual's inner needs. It can be personalized based on the individual's life journey, encompassing both joy and sorrow, loss and gain, and the quest for meaning. Spiritual care should always be delivered in a person-centered way, respecting the individual's unique journey. It requires a careful balance between the art and science of care. The science involves evidence-based practices, measurable outcomes, and ongoing process improvements, while the art focuses on self-awareness, sensitivity, and personalized communication, ensuring that care is tailored to the person's spiritual and emotional needs. Spiritual care differs from religious care. Spiritual care is a one-on-one, person-centered practice that doesn't assume a particular belief system or orientation. It focuses on the individual's spiritual needs, which can exist independently of religion. In contrast, religious care is based on shared beliefs, rituals, and the lifestyle of a faith community. It's important to recognize that spiritual care should not be proselytizing or limited to chaplains. It's a broader, inclusive practice. Spirituality addresses fundamental human needs as described by Maslow's hierarchy of needs and Alderfer's ERG theory. It offers structure, meaning, and emotional support, especially during life challenges or declining health. As people face their mortality, their reliance on spirituality often increases. Spiritual well-being is linked to better physical and psychological outcomes, promoting positive aging, health, and overall quality of life. Studies show that spirituality contributes to resilience and quality of life in both healthy and chronically ill older adults. Spiritual needs can be categorized into 3 dimensions, which align with Alderfer's ERG, existence, relatedness, and growth, model of core human needs. These dimensions reflect how individuals seek existential meaning, relate to others and themselves, and pursue personal growth. For older adults, fulfilling these spiritual needs can greatly enhance life satisfaction and emotional well-being. The relatedness aspect is particularly important, emphasizing connections with others, community, and self. Positive aging encourages viewing older adults as whole individuals, not merely in terms of their health issues. The focus is on helping them plan for and navigate the changes of aging in a productive, active, and fulfilling manner. It emphasizes maintaining a sense of independence, dignity, and well-being, enabling participation in society. Innovations and research can help older adults experience life with purpose and fulfillment as they age. Positive aging encompasses several key aspects that contribute to an individual's overall well-being as they grow older. First, maintaining relationships is essential, as strong social connections help promote emotional health. Having good family and social support systems allows older adults to feel cared for and connected to others. Active participation in activities and within the community keeps individuals engaged and provides opportunities for personal growth. A positive attitude toward oneself is crucial for self-esteem and mental health. Lastly, having a sense of purpose gives meaning to life and promotes resilience and optimism. These elements are deeply connected with spirituality, as they address the holistic well-being of the individual. Spirituality plays a crucial role in promoting positive aging by reducing feelings of helplessness, loss of control, and isolation, particularly in older adults facing illness. It offers a sense of purpose and acts as a tool for resilience, helping individuals cope with life challenges, including chronic illness and dementia. Spirituality also fosters social support, providing a sense of connectedness and belonging to a community. This is especially important for maintaining optimism and enhancing well-being during later life stages. Spiritual care is most effective when approached in a multidisciplinary and interprofessional way. It involves healthcare practitioners such as nurses, chaplains, social workers, and other allied health staff. Spiritual care should be integrated into the daily practice of these professionals, as it allows them to view patient care through a spiritual lens. This approach helps address the emotional and spiritual needs of older adults and their support networks, ensuring holistic care that promotes meaning and purpose in their lives. Different healthcare professionals play key roles in providing spiritual care. Nurses are crucial in offering spiritual care, which impacts not only patient health, but also staff well-being. Chaplains and pastoral care practitioners are often involved in providing emotional and end-of-life support, including prayer. Social workers contribute by conducting spiritual assessments and addressing the cultural and spiritual needs of patients. They also help break down structural barriers that may prevent patients from receiving the care they need. Psychiatrists often acknowledge that spirituality can be tied to higher recovery rates and better mental health outcomes. While some refer patients to pastoral care, 78% of psychiatrists agreed that they would not let their own beliefs prevent them from offering a complete range of treatments. Allied health staff, such as those in medicine, nursing, and occupational therapy, increasingly consider spirituality in their work. Interestingly, while 96% of physiotherapists recognize the importance of spirituality, only 30% address spiritual concerns, citing barriers like lack of time, uncertainty about how to handle spiritual issues, and limited experience in taking a spiritual history. There are several internal barriers to providing spiritual care. Communication issues, such as sensory loss, language problems, or cognitive impairments, make it difficult to address spiritual needs. Emotional demands also pose a challenge, especially for staff repeatedly facing the grief of terminally ill patients. Furthermore, healthcare staff often lack the necessary training or knowledge to assess and address spiritual needs effectively, which can limit the spiritual care provided to patients. External barriers to spiritual care include organizational factors such as management attitudes, heavy workloads, and time constraints. These factors often make it difficult for healthcare providers to prioritize spiritual care. Additionally, a lack of education around spiritual care can lead to discomfort among physicians when addressing non-medical issues. Ensuring privacy for patients can also be challenging in care settings. However, the use of technology like telephones and video calls can help maintain connections between patients and their loved ones, offering spiritual support and connection. Spiritual assessment is the process of gathering, analyzing, and synthesizing spiritual and religious information about a patient to inform care decisions. It involves documenting a patient's spiritual preferences and needs and integrating them into clinical and lifestyle care plans. The assessment should focus on key elements like the patient's religious background, significant spiritual beliefs, and important spiritual practices. This ensures that care is holistic, addressing both physical and spiritual needs. Spiritual assessment can be conducted both informally and formally. Informal assessment involves actively listening to patient stories and recognizing spiritual themes, such as a search for meaning or feelings of connection versus isolation. Formal assessments use direct questions to determine the role of spirituality in the patient's illness or recovery. Various tools such as the Spiritual Needs Questionnaire, SPNQ, and HOPE questions can be used to structure these assessments, providing insights into the patient's spiritual needs. The HOPE framework helps healthcare professionals explore patients' sources of hope, strength, and comfort. Key questions include asking what gives them internal support during challenging times, what sustains them, and whether their spiritual or religious beliefs offer comfort. These questions are crucial in understanding the role spirituality plays in the patient's coping mechanisms. If spirituality is important to them, the provider can explore further with other HOPE questions. The O in the Hope questions addresses the role of organized religion in a patient's life. Key questions explore whether the patient is part of a religious community, how significant this connection is, and whether the community provides support. Understanding the importance of organized religion helps in tailoring care to respect and incorporate the patient's spiritual and religious affiliations. The P in the Hope questions focuses on personal spirituality and practices outside of organized religion. It helps explore the patient's personal beliefs and practices that bring them comfort and strength. Questions such as, what is your relationship with God? And what spiritual practices are most helpful to you? Allow healthcare providers to understand the patient's personal spiritual framework and incorporate it into their care plan. The E in the Hope questions explores how illness affects a patient's spiritual practices and their medical care. It addresses whether being sick has impacted their ability to engage in spiritual activities, and if there are any conflicts between their beliefs and the medical treatment they are receiving. Asking if they would like to speak to a chaplain or spiritual leader helps ensure that their spiritual needs are met. This part of the assessment is especially important for end-of-life care. Spiritual assessment tools provide a structured approach to identifying and understanding an individual's spiritual needs. These tools help measure different aspects of spirituality, such as religious and existential needs, the search for inner peace, and the desire for giving or generativity. The use of these tools is essential in offering holistic care by ensuring that spiritual concerns are addressed alongside physical and emotional needs. Spirituality has a positive association with mental health, particularly for older adults in care facilities. The transition to residential age care can be emotionally challenging and often leads to feelings of depression or anxiety. Research shows that spirituality can provide a sense of meaning, purpose, and emotional resilience, helping individuals recover from depression and improve their overall quality of life. Spirituality-based interventions have been shown to significantly enhance the well-being of older adults, especially those experiencing mental health challenges. Spirituality becomes especially significant during end-of-life transitions. It helps individuals cope with grief, loneliness, and unresolved emotional or spiritual issues. For many older adults, spirituality provides comfort and a sense of meaning as they face mortality. Life review and reflecting on one's life contribution can also help bring peace during this stage. Spiritual care is an essential component of palliative care, offering psychological and spiritual support to both patients and their families as they navigate end-of-life challenges. People with dementia continue to have spiritual needs despite cognitive decline. Emotional and sensory experiences such as music, art, and storytelling are effective in connecting with them. For those with a religious background, engaging in familiar spiritual practices offers comfort. Building caring and trusting relationships is especially important for those without a religious background, ensuring their spiritual well-being is nurtured through meaningful connections. Spiritual care encompasses several domains that healthcare systems should integrate. Organizational leadership ensures spiritual care is part of the structure, with support for staff. Building meaningful relationships and assessing spiritual needs regularly helps tailor care to the individual. Ethical care means respecting diverse spiritual beliefs and creating an inclusive environment. Lastly, spiritual expression is supported through activities, storytelling, and connection to nature, allowing patients to maintain purpose and meaning. Organizational leadership plays a crucial role in ensuring spiritual care is embedded at all levels, from policies to daily practices. Leaders should support staff in understanding and providing spiritual care, especially during emotionally demanding transitions. Technology such as video calls, podcasts, and messaging platforms can be used to help patients maintain connections with loved ones and their community. Providing access to outdoor spaces or using nature-inspired experiences, such as bringing plants and flowers into rooms, can also enhance spiritual care and well-being. In spiritual care, building genuine relationships is essential. Care should be centered on the dignity and worth of each individual. Healthcare staff need to be trained to engage spiritually with older adults, understanding their own spirituality and knowing how to support patients in exploring theirs. Spirituality should be woven into all care roles, and the use of technology or visitor-friendly spaces can help older adults maintain important connections with family and friends, supporting their emotional and spiritual well-being. Spiritual care begins with a personalized assessment of each individual's spiritual needs. These needs are then documented and incorporated into their clinical and lifestyle care plans. A multidisciplinary approach involving various healthcare professionals ensures that care is dynamic and adapts to the evolving spiritual needs of the individual. It's important to reassess spiritual needs regularly, especially after major life events such as trauma, illness, or loss, to provide holistic care that addresses emotional, psychological, and spiritual well-being. As older adults transition through various stages of aging, they must be supported in finding meaning, purpose, and connectedness. Activities and lifestyle programs should reflect their individual choices, preferences, and needs. End-of-life spiritual care is especially crucial, offering opportunities for life reflection and legacy building. This includes affirming their identity and uniqueness, addressing unresolved issues such as fear, guilt, or unfinished business, and ensuring their spiritual care needs and preferences are respected in palliative care. Advanced care planning and respecting death rituals also play a vital role in this process. Spiritual care must be provided within an ethical framework that respects the patient's spiritual choices and beliefs. This care should be integrated into the overall care plan, addressing not only physical and psychological needs, but also spiritual and cultural dimensions. A culture of acceptance and inclusivity is essential, where spiritual views and practices are respected, and patients' right to self-determination regarding their spiritual care is upheld. Offering spiritual practices such as prayer, meditation, or religious rites must be done respectfully and based on the patient's preferences. Spiritual care should include a range of individualized activities that help patients find meaning, purpose, and connection. Life review activities, such as storytelling and autobiographical writing, allow older adults to reflect on their past and share their experiences, which can be passed on to future generations. Participation in spiritual practices, whether religious or personal rituals, should be encouraged to promote spiritual growth and resilience. These activities help individuals transcend loss and disability while maintaining a sense of connectedness. Spiritual expression can be enhanced through nature and the arts. Access to the natural environment, whether through gardens, outdoor outings, or bringing nature indoors with plants and flowers, fosters a sense of peace and connectedness. Participation in artistic activities like music, painting, storytelling, or dancing supports spiritual growth and well-being. Religious and spiritual practices such as prayer, meditation, and rituals should be encouraged and facilitated based on the individual's preferences. This helps individuals maintain their spiritual connections and cope with loss, grief, or end-of-life transitions. Spiritual needs can be viewed through the lens of connection. Older adults may seek connection with others, nature, and their creative expressions like art or music. Additionally, many find meaning through a deeper connection with themselves or something greater, such as a higher power or God. Understanding and fostering these connections helps support their spiritual well-being, promoting a sense of belonging, purpose, and peace. Here are our references. Thank you for listening to this presentation.